This is my wound care video. The first thing I'm going to do is verify the provider's orders. I'm then going to gather all the necessary supplies and equipment. I'm going to introduce myself to the patient and family. I'm going to perform hand hygiene and pull the curtain for patient privacy. I'm then going to identify the patient using 2 identifiers and comparing them to the patient's ID bracelet. I'm going to assess their pain status while explaining the procedure to the patient and ensuring that he or she agreed to this treatment. If I was at any risk of spray, I would be applying a gown, goggles, and a mask. I'm going to position the patient comfortably and drape him or her, only exposing the wound site. And I'm going to instruct the patient not to touch the wound or any sterile supplies. I'm then going to place a disposable biohazard bag, folding the top to create a cuff. I'm now going to apply clean gloves. I'm going to pull the tape parallel to the skin and in the direction of any hair growth. I'm going to remove the top layer, observing any drainage. I'm going to fold it away from the patient so that they don't see anything. And I'm going to place it in my biohazard bag. Working slowly and carefully, I'm going to remove the underside of the dressing and keep it out of the patient's sight, observing the drainage and folding it and placing it in the biohazard bag and removing my gloves. I'm going to perform hand hygiene and apply clean gloves. I'm going to inspect the color and integrity of the wound. I'm going to look for edema, exudate, and loss of skin integrity. I'm going to observe any damage or drainage around the skin and any other devices. I'm going to assess for odor. I'm going to gently palpate the edges of the wound and determine the patient's pain if it has increased or not. I'm going to measure the length, width, or depth if it's indicated. I'm now going to dispose of these gloves and perform hand hygiene. I'm now going to create a sterile field. I'm going to grab my sterile dressing tray. And I'm going to grab my sterile gloves. I'm going to grab the necessary supplies, my inner and outer bandage, my saline, my tape, and some more gauze pads. I'm now going to cleanse the wound. Using antiseptic swabs, I'm going to place it in the saline and clean from least contaminated to most contaminated and dispose. Saline, least contaminated to most contaminated, dispose. I'm now going to blot the wound dry. If I had any drains, I would have done the same technique around the drain with sterile solution and then patting dry using circular strokes. I'm now going to apply my loosely woven gauze as the contact layer. I'm then going to apply my outer layer and tape and secure. I would now label my dressing according to my hospital's policies. Now that my patient's wound is dressed, I'm going to remove my sterile gloves and apply clean gloves. Going to clean up my area. And place everything in the biohazard bag. And remove my gloves and perform hand hygiene. I'm now going to help my patient into a comfortable position, place their toiletries and call light in reach. I'm going to raise the appropriate number of side rails and lower the bed in the lowest position and document any expected or unexpected outcomes.